Okay, let's talk about age of onset and some other factors affecting the pedigree patterns. So first we should know that not all genetic disorders are congenital, meaning that many are not expressed until later in life. Some are expressed at a characteristic age and others are at variable ages. A genetic disorder is determined by genes, and a congenital disease is one that is present at birth, and it may or may not be genetical. Anyway, many genetic disorders develop prenatally and thus are both genetic and congenital. An example of this would be osteogenesis imperfecta. So remember, osteogenesis imperfecta is both genetic and congenital. And some may be lethal in prenatal life. So remember, you think about trisomy 21 and Down syndrome, where the 21st chromosome you have 3, but the child will still survive. But you don't see a lot of other chromosomal changes because it's not consistent with life. So other disorders are expressed as soon as the infant begins independent life, and others appear later at a variety of ages from birth to post-reproductive years. So it's not always something that you will see before puberty, but generally you're going to see a lot of them before the child reaches puberty, particularly with the autosomal recessive disorders, which you will see in the childhood years, as previously explained. So let's talk a little bit about other factors affecting pedigree patterns. One is small family size. The patient may be the only affected member, and so then the inheritance pattern may not be immediately apparent. Next, new mutation. So a new mutation is a frequent cause of autosomal dominant and X-linked diseases. And there are other diagnostic difficulties, and these are owing to absent or variable expressions of the gene. So we're talking about counseling here, where you would be looking at a pedigree, or you'd be looking at a person who coming in with something to say, and you're trying to help them figure out what's going on, but you're not always able to diagnose or to make predictions. Other genes and environmental factors may affect the gene expression, so it's not always apparent by looking at the pedigree, and persons of some genotypes may fail to survive until the time of birth, as explained earlier. So you may not, because this is not expressed, it's going to be hidden. So then also you may not have accurate information about the presence of the disordered relatives, or about the family relationships may be lacking, and they may not tell you everything that you need to know. Okay, so that's it regarding age of onset and other factors affecting pedigree patterns.